Okay, so good morning, everyone. After a break of one Monday, we are here with to discuss a very important topic. What is the role of music therapy in palliative medicine? We all know that when we are busy in some listening music or singing, we really it gives a lot of peace, and it's almost a very soothing experience for almost everyone. And those who have not experienced, please experience it, because listening music and singing is a good habit, or it gives you peace. So for this today we have a presenter is Dr. Arkanil. Arkanil is our third year MD student, and he himself is a very good singer. He is singing in almost every part, every function, and big or small function. He's singing with very beautiful songs, always with the guitar. And for moderation, we have Dr. Anuja Pandit. Anuja is our one of our brightest faculty member of the department. I call the few Miss like jewel of the department. So she's one of them. And you all must be knowing that we have a monthly program from Shankar Mahadevan Academy. And we started working with Shankar Mahadevan Academy people with that whether we can do something and create an evidence from our country that uh, definitely music helps in soothing and in giving better quality of life to these cancer patients. So we have started working on a research project. It's almost going very slow, but it is a new thing, so it will go slow. And probably we will be involving a lot more other centers also, those who are joining Shankar Mahadevan Academy program. So with this starting note, I would like to request Anuja and Arkonil to start their lecture, and everyone is waiting because this is a new topic and a lot of things they will learn from today's lecture. Thank you.
Thank you, ma'am. Thank you for the kind introduction. So, we will be discussing music therapy in palliative medicine. In the thing is that, like ma'am said, aptly said that uh, that music therapy, just listening to music is so relaxing for us during any stressful time. And I must commend Arkanel because he is an outstanding, musician. He just does not just uh, listen or sing or plays music, but it's his passion, and he knows the intricacies of every note, high and low, and which he's going to explain further now in the presentation. What I want to emphasize is that music therapy, it's not just relaxing, but scientifically proven to have an impact on quality of life, which Arkanil has included the evidence for in his presentation. So I would like to invite Arkanil to start.
Good morning, everyone. Today's topic is the integration of music therapy in palliative care. It's a huge topic, but we have tried to just cut it short, and just present it in 40 or 45 minutes. So, coming to the definition, it's a new thing, the music therapy. What is music therapy? It's a controlled use of music to influence the human physiology and alter physiological and emotional status for the betterment of the patient or a person. So the history of music therapy is long ingrained in Western world and the Eastern world also. So coming to the Western world, the scientific interest in musicotherapy commenced during the experience of the World War One and Two. The value was mainly recognized for the reconditioning and of the traumatized soldier and the wound healing. Music therapy, as we know, it began in the aftermath of World War One and Two, when particularly in the United Kingdom, musicians would travel to hospitals and play music for soldiers suffering from war-related emotions and physical trauma. Some neuropsychiatric causes could only be reached via those music. So again, coming to the history of music therapy in the Eastern world, the Vedic philosophy called this area of Nada Vidya There was two types of nada. One was the anahata nada, the sublime sound, the yoga, and the ahata nada, which is the audible music. It was postulated that the seven notes affected the seven primary chakras of the human body. The Muladhara chakra, or it is the Sa note, and the Swadhisthana chakra, it is the Re note, and the Sahasrara chakra, it is the Ni note. The Eastern philosophy contains a core of truth, but this is confounded by the padding of arbitrary theory, unprobable hypothesis, and the mythology also. So this is the pictorial representation of all the chakras: the Shastra chakra, the Anjana chakra, the Vasudhana chakra, the Ahata chakra, the Manipura chakra, the Swadhisthana chakra, and the Muladhara chakra. There were several diseases which were treated by those kind of chakras, and they signifies the name of the diseases, like the Miyanki Mallar and the Darwari Kannada is for the bronchial asthma. The Vaivari one was for the asthma, sinusitis, and chest problems. The Malhar was for reducing anger and stress. The Aswari rag was for the impurities of blood. The Todi was for the high blood pressure. Deepak for gastric acidity. The Gunakali for constipation. Hindol and Marva for high fever and malaria. These all are written in the Vedas. And coming to the Western world, the Greek introduced the concept of sports and music as contributing to good health. Apollo was the god of music. He gives birth to his son in the form of Asclepius, the god of healing of the medicine. Homer believed that music could be used to negate the negative feelings also. Music has been used as a healing implement for centuries. Like we said that Apollo was an ancient god. Plato said that music affected the emotions and could influence the character of an individual. Aristotle thought that music affects the soul and described music as a force that purified the emotions. Aulus Celsus advocated the sound of cymbals and running water for the treatment of mental disorders. Music therapy was practiced in biblical times also, when David played the harp to rid King Saul at a bad spirit. As early as the 400 BC, and the Hippocrates played music for the mental patients. In the 13th century, in the Arab hospitals, contained the music rooms for the benefit of the patients. In the United States, Native American medicine men often employed chants and dances for the method of healing. So we can see that all over the world there is a history of music therapy. So it was already a proven thing, but literature came later. Music is an enigma. Shakespeare asked that, is it the strange that ship that should hail souls out of men's bodies? So it is a biblical reference what Shakespeare draws. So coming to the physiological aspects of music in humans, the music is processed in the reticular activating system in the brain. Impulses from various sensory pathways relay via collaterals to the RAS system. And coming to the RAS system, the significance of RAS system is it contains center of respiration, the center of blood pressure, the center of heart rate, the center of vegetative function. So anything which is coming to this RAS system will affect all these functions. When music is listened to, sensory stimuli travel along ascending sensory fibers to the neurons of the RAS. These stimuli are projected to the thalamus, and from there it goes upwards to the cerebral cortex, the limbic system, the corpus callosum, and it goes downwards to the autonomic nervous system and neuroendocrine system.
Kunal, sorry to interrupt you. I'm just requesting you to go a little slow here, because these are the physiology and it's important to understand. So let's just go a little slow.
Okay.
Yeah, speak slow.
So processing of the music in the brain. When music reaches the cerebral cortex, the primary processing occurs in the temporal lobe, like we can see in the pictorial diagram. From the temporal lobe, impulses go to the association cortex, and the association cortex is the highest level of thinking, which is done there, and the mathematics, the symbolic thoughts, etc., are done in the association cortex only. And coming to the limbic system, coming to the anatomy of the limbic system is located in the border between the cerebral cortex and the brain stem. And the function of limbic system is controlling emotions, memory, and learning. So music will affect these three things also. Components of the limbic system contains cingulate gyrus, the hippocampus, fornix, hypothalamus, mammillothalamic tract, anterior thalamus, mammillary body. So all these structures are related to learning, decision making, and understanding or comprehension of anything. Music and the limbic system. When music is played, all areas of the limbic system are stimulated. So there is a PET scan data when it is stimulated by the eye. So it will show some shine on that PET scan also. and biochemical basis is when music is played, the levels of phenylethylamine are increased in the limbic system. So phenylethylamine is the same constituent which is increased while we are taking the chocolates or something. So anything happiness which is getting instilled inside us, it will come as the phenylethylamine inside our brain. So this neuroamine is responsible for the feeling of love in animals. This neuroamine is naturally found in chocolate also. So music has also effect in the corpus callosum, which is joining the two hemispheres of our brain. Music has been shown to activate biochemical and electrical memory material across the corpus callosum so that the two hemispheres can work better together rather than in opposition. So coming to the effect of music on the autonomic nervous system, so it has effect on both the sympathetic and the parasympathetic nervous system. The music tones down the sympathetic nervous system, so the parasympathetic nervous system overrides the stimulatory effect of the sympathetic system. So how it works, it leads to the relaxation response. So rightly, when today we first discussed that music relaxes us. So how does it relax us? So it decreases the heart rate. It has effect on the BP. Sometimes it lowers, sometimes it higher BP. It has effect on the regular deep breathing, on the muscle relaxation, and the alpha brain waves also. So it has effect on the autonomic nervous system. So it will again affect the endocrine system also, because those things are connected only. So music affects us in the three pathways in the neuroendocrine system. It helps in secreting the endorphins. These are natural opiates released from the pituitary gland. So we all know that it relieves pain and enhances mood. And catecholamines, these are reduced by music because these are all stress hormones. So it will eventually increase the heart rate and increase the BP. So there will be metabolic rate increasement. These will also decrease the level of corticosteroids in our blood. So corticosteroid is also a stress hormone. So what is cutting it short, the music will increase the happy hormones inside our brain and the neurotransmitting zones, and it will decrease the hormones which are related to stress. So again, coming to the stress and endothelium. So vascular structures are related to music, related to secretions of the neurotransmitters, and it is eventually related to the stimulus coming from outside, which is music in this case. The stress causes unhealthy behavior and rise in the stress markers like cortisol and fibrinogen and catecholamines. So cortisol will cause the furred up arteries, the fibrinogen causes increased clotting, catecholamines causes raised heart rate and blood pressure. There are probably a greater number of biochemical changes which have been inadequately studied yet. So there is a lot to explore in this domain only. So all these data which we got from the literature, so can we just call it music as a placebo effect, or music has a nocebo effect also? So what is placebo effect? Placebo effect is a belief and expectancy of patients of benefit, belief and expectancy of caregiver of benefit, belief and expectancy generated by the relationship between the patient and the caregiver of benefit. So it enhances the placebo effect and both the nocebo effect. So studies, there are literature studies have been done on the music therapy in past, like on the cardiac system. Meckel et al. Studied on a healthy individual. Bernardi studied on healthy individuals. One study was done on the patients of acute myocardial infarction, which was done in 1999. In 2008 is the latest one. It was a study done on the patients of stable angina. Studies on the neural system coming to this Parkinson's disease was well discovered, and the role of music in Parkinson's disease is well recognized all over the world. And coming to the cancer patients, Ferrer did a study in 2001 in Florida over the cancer patients, and for the Alzheimer's disease and depression, the study was done also. So coming to the study done on the cardiovascular diseases, the presentation was made in random order of 6 different music styles, first of 2 minute, then for 4 minute track, with a randomly inserted 2 minute pause in their sequences. So outcome measures were valued and calculated over the breathing rates, ventilation, carbon dioxide, the RR interval in the ECG, the blood pressure, the mid-cerebral artery flow velocity, and the baroreflexes. In case of the ventilation and the respiration, both were increased in this on the effect of the music. It was found that the mid-cerebral artery flow velocity and the baroreflex decreased with faster tempo, and simpler rhythmic structures compared to the baseline. The pause reduced heart rate and blood pressure and minute ventilation even below the baseline. So when you are just playing the music, it's increasing the baroreflexes and the flow in the artery, and whenever you are giving the pause, it is again coming down. So you can clearly see the effect of music on hand only. And order effect was evident for mid-cerebral artery flow velocity, indicating a progressive reduction with exposure to music independent of style. Musicians had greater respiratory sensitivity to music tempo than the non-musicians. There were no major differences between musicians and non-musicians, but the analysis of variance model showed both the baseline and during the listening that musicians had a significantly lower respiratory during the pause and increased their breathing rate more the non-musicians in response to the increasing tempi. So we can see the musicians, as their senses are more sensitized to the sensory inputs of music, so the effects of music is always more on the musicians who have been sensitized with the receptors and the stimuli in further in the past. Even short exposure to music can induce measurable and reproducible cardiovascular and respiratory effects, leading to a condition of arousal or focus attention that is proportional to the speed of the music, that may be induced or amplified by respiratory entrainment by the music's rhythm and the speed. This effect is independent of preferences or the repetition and habituation, and is clearer when the rhythmic structure is simpler. A pause in the music induces a condition of relaxation greater than the preceding the exposure to music, and leads to the speculation that music may give pleasure as a result of its controlled alternation between arousal and relaxation. It may be viewed as an alternative technique of relaxation and meditation without involving the active participation of the subject. So it's a passive technique when you are making the person to relax and meditate without making him do something, just putting some sensory stimuli through the music. Music is increasingly used in treating cardiovascular, neurological, and respiratory diseases. If music induces similar physiological effects in different subjects, standard therapeutic interventions would be possible. Consistent dynamic cardiovascular and respiratory responses to music were observed. Almost every music crescendo or emphasis induced progressive skin vasoconstriction. So again, it is affecting the autonomic nervous system, which is causing the arterioles to constrict, and it's affecting the vasomotion. The degree of change in the cardiovascular variables parallel those in the music envelope, with highly significant correlations, the most with skin vasomotion and the least with the RR interval. The skin vasomotion is the rhythmic variation of skin microvessel diameter responsible for skin microcirculatory blood flow oscillation. The so-called skin blood flow motion, it can be easily investigated by the means of the spectral analysis of skin laser Doppler flowmetry, which can just measure the diameter while the music has been played, and you can see that there is constriction of the music when you are putting the tempo high, and there is relaxation of the muscles again when you are giving a pause. So experimental and clinical findings suggest that vasomotion is particularly dependent on the microvascular endothelial activity. Particularly during crescendos, although the extreme responses to arousing phrases, when we see the goosebumps, sometimes we hear the music, we listen to the music, we say that we are having goosebumps. So there is the mechanism of the goosebump while you are listening to a music. It was found that there are subconscious reflex autonomic responses involving the respiration and the cardiovascular parameters that are common to all subjects, independent of music preferences and previous training. So non-musicians and musicians will have the same effect of goosebumps. It won't vary with the training or the previous exposure. Musical profile was closely mirrored in the skin microvasculature, which suggests a possible lower connection between the auditory sensation and the cardiovascular relaxation. So what is the entrainment of respiration? One of the features of the biological oscillators is that ability to synchronize to or to be entrained by the external inputs. While the exact nature of the central respiratory pattern generating system remains open to debate, it may broadly be classified as a form of oscillator. And this oscillator may be entrained by a wide range of inputs, including afferent feedback from muscle during rhythmic movements of exercise, by somatic afferent of stimulation, vestibular stimulation, or by cardiac afferent inputs. The ability of these non-respiratory inputs to alter the respiratory timing. So music is also one of them. When you are giving inputs from the outside, which is controlling your respiratory entrainment, so studies have proven that music is also a sensory input in this case. Auditory inputs have also been shown to produce entrainment of respiratory timing, as well as to the certain spinal motor responses and to produce faster reaction times. In addition to the describing increase in respiratory frequency, Bernardi and colleagues also noted the increase in the heart rate and blood pressure, with the increased gain correlated to the music tempo. Whether the observed increases in the heart rate and the blood pressure are an independent consequence of entrainment of sympathetic neural oscillators on the brain or due to the respiratory influences on the sympathetic outflow may be difficult to establish. But both these things happen simultaneously when you are inputting any sensory effort like music here. So it's a debatable thing that from where the input is coming and what's the mechanism of action here. So coming to the study on the angina pectoris, which is a study population where all the chronic stable angina patients were taken. 70 patients were taken in this case. The study design was a single blind randomized trial. Patients selected when the study group were given a CD which contained the raga music, the Indian classical music. Actually, they instructed to listen to at home twice a day for 1 month. Study results were subjective and objective improvement was seen. According to 2009 Cochrane review, some music may reduce the heart rate, respiratory rate, and blood pressure in those with coronary heart diseases. So this was a great study, which actually was a systematic review. And it showed that it has clear evidences that in case of high blood pressure or people with metabolic diseases, people with NFLD, or people with coronary artery diseases may be affected by music, and it can be used as a sensory input to reduce their symptoms. Listening to music based on Indian classical system twice a day for 1 month period, complementary to usual treatment, significantly improved the quality of life for the stable angina patients aged between 45 and 65 years, which is measured by the SF36 questionnaire. A similar improvement did not observe in the control group who were only on prescribed medicines. So in the non-pharmacological, again coming to this, the non-pharmacological interventions, if you are just conglomerating it with the medical interventions, you will always see better effects than those with people which are getting only the pharmacological therapy. So again, this is a pictorial presentation of the thing that the pharmaceuticals, the self-care or the non-pharmacological care, and the surgery and procedure, these are the tripod of care given. So this is a picture of the complete care, and you can just visualize the thing whenever you are treating a patient, that not only the medicines, there are several aspects of medicine, and not only giving the drugs to a patient, there are several aspects to a complete medicine and complete care. So again, coming to the total care concept, like when you are treating a patient, the drugs, surgery, and mind and body medicine. So coming to in previously, the mind and body medicine, it was not that explored, but with time, with researches and newer practices and newer literature, we are going into the era where we are focusing on these aspects only, like relaxation responses, positive coping strategies, physical activities, nutrition, social support. So these are all important and very important aspects of complete care. So scientifically, musical therapy could be accepted as an ancillary therapy for psychosomatic diseases. You just cut it short, like cardiovascular diseases to reduce high blood pressure, angina symptoms, palpitations, SVTF, all the rhythmic disorders, and respiratory diseases like asthma and rhinitis, GI diseases, ulcers, ulcerative colitis, IBS, nausea, vomiting, skin symptoms like itching, psoriasis, eczema. And in neurological diseases, it's really proven that in neurological diseases, music has a great effect, like migraine, tension attacks, vertigo, Parkinsonism, weakness of muscles. In rheumatological diseases, in the pain where it comes from the rheumatoid arthritis, lower backache, and in diabetes mellitus, amenorrhea, and in immunological diseases also. So there are several relaxation techniques which is related to music, and apart from that, there are yoga, the meditation, the music therapy, the massage therapy, the aromatherapy, the soothing hobbies. These can also be used as the non-pharmacological interventions in treating any diseases or palliating the symptoms of any disease. So we can reduce the disease burden and increase the quality of life of the patient only. So again, this is a chart. If you want to just memorize the effect of music in the metabolism and the physiological parameters, which is previously discussed only. So it increases the metabolism, blood pressure, rate of breathing, muscle tension, and it slows down the brain waves. So it helps to. So the goal of the care is that it helps to relaxes you down. And coming to the components of music, so the physical characteristics of music are mainly based on the tempo, pitch, and the volume. The musical characteristics are like the melodic system, the harmonic one, and the rhythmic one. So the tempo is the speed of music. In a study on the sick children, a tempo of 60 to 70 beats per minute was found to be most soothing. So the tempo in the human heart rate, everything which is oscillating in a rhythm, music can affect those parameters of our body. In the Miami study, a faster tempo induced tension, a slower tempo induced feeling of suspense. So again, tempo is important and it can affect our physiological parameters. This depends the pitch. The pitch depends on the wave frequency. In the Miami study, the high pitch led to tension, the low pitch led to the relaxation. So the high frequency sounds like the do and the sa note will have a frequency of 256 hertz. So this can actually increase your tension and relax you down when you are just lowering the pitch. And coming to the volume, this depends on the amplitude of the wave. Like the high volume causes tension and the low volume again causes the soothing feeling. And coming to the melodies, the melodic system, which is mainly used in all these studies with the raga and the classical and the dodecaphonics, the genre of music. And in case of rhythmic, the thala in Hindustani music, the jazz, the waltz, the rap, the country, the tango, etc. was used. And the harmonic overtunes were also used. And coming to the brainwaves, so researchers have shown that the music with a strong beat can stimulate brainwaves to resonate and synchronize with the beat. With faster beats, bringing the sharper concentration and the more alert thinking, and the slower tempo promoting a calm, the meditative state. Also, research has found that the change in the brainwave activity levels that music can bring can also enable the brain to shift speed from easily to its own as needed, which means that music can bring lasting benefits to a patient's state of mind even after the patient has stopped listening. So it has a long-term effect. Music is not only when you are listening to music, even if you have complete or finished listening to music, the effect will carry out and carry through with you, and you will have the benefits of listening to music in your daily life, even if you are not a patient or not suffering for some diseases. With alterations in brainwaves comes the changes over the bodily functions. Those governed by the autonomic nervous system, such as breathing and heart rate, can also be altered by the changes music can bring. This can mean the slower breathing, slower heart rate, and an activation of the relaxation response. It was discussed previously also. And coming to the state of mind, music can also be used to bring more positive state of mind. So the thinking of the positivity, which we all need, that when you're starting a day, you need the huge bulk of positivity and pulses of positivity. You can listen to music and it can wash away your depression and anxiety, and then they put them in the way. This can help prevent the stress response and can help to keep creativity and optimism level higher. Other benefits, music has also been found to bring many other benefits, such as lowering the blood pressure, the boost the immunity, ease the muscle tension. So everything is related to some positive inputs only. Music therapy primarily helps clients improve their health in several domains, such as cognitive functioning, motor skills, emotional development, and social skills, and the quality of life, which is most important in the palliative patients. The clinical therapy, psychotherapy, biomusicology, musical acoustics, music theory, the psychoacoustics, the embodied music cognition, aesthetics of music, sensory integration, comparative musicology. These are all the constituents of music therapy and approaches used in music therapy. So coming to the this portion of the presentation, we will show them how music therapy works and how we can use the music therapy in our clinical day-to-day activities. So We can use the Whorf, the eurythmics, and the Kodali. The models that develop directly out of the music therapy are the NMT, which is the neurologic music therapy, the Nord of Robbins, and the Boni method of guided imagery and the music. These are all sensory stimulants given to the patients to improve their relaxation techniques and improve their quality of life. One therapy model based on the neuroscience is called the neurological music therapy is based on a neuroscience model of music perception and production and the influence of music on functional changes in non-musical brain and behavior functions. In other words, NMT studies how the brain is without music, how the brain is with music. So you can compare now, measures the differences and the uses of differences to cause changes in the brain through music that will eventually affect the client non-musically. So NMT is always used on daily basis in case of treating the Parkinson's patients or Alzheimer's patients or patients suffering from NMD, suffering from MND. The use of music therapy is treating mental and neurological disorder is on the rise. The music therapy has showed effectiveness in treating symptoms of many disorders, including schizophrenia, amnesia, all the neuropsychiatric disorders like dementia, Alzheimer's, Parkinson's, all the mood disorders like depression, aphasia, and similar Tourette syndrome. So we can see that with time in the Western and the Eastern world, we have progressed so much that we are using music to treat all the neurodegenerative disorders which are giving the patients a high symptom load, and the patients are suffering for long. Maybe they are going into terminal stages, they are going into the palliative care, and we are giving music to them. More recent research suggests that music can increase a patient's motivation and positive emotion. So again comes the spirituality. So from the physiological parameters, we are just shifting our focus on the spiritual aspects of music also. Current research also suggests that when music therapy is used in conjunction with traditional therapy, it improves success rate significantly. Therefore, it is hypothesized that music therapy helps a victim of stroke recover faster, with more success by increasing the patient's positive emotions and motivation, allowing him or her to be more successful and feel more driven and participate in traditional therapies. So they are here in patients who are suffering from neurological disorders. It's mostly also related to psychological clinical depression, and depression comes with the feeling of hopelessness and the feeling of anhedonia, that you can't do anything, but music gives you that power and the positive emotions. It instills inside you the positive emotions which can make you feel motivated, and it really helps those patients. Recent studies have examined the effect of music therapy on stroke patients when combined with traditional therapy. One study found that incorporation of music with therapeutic upper extremity exercises give patients more positive emotional effects than the exercise alone. So apart from the physiotherapy, which is a well-known modality in the treatment of the neuromuscular disorders, we can give the music and it will actually augment the effect of those therapies. In another study, Nayak et al. Found that the rehabilitation staff rated participants in the music therapy group more actively involved and cooperative in therapy than those in the control group. So the compliance is again getting increased by the use of the music therapy. Now coming to the treatment of dementia. Dementia is one of the most common genetic diseases we can come across all over the world. So like 75% of the geriatric population is suffering from Alzheimer's disease, and other types of dementia are among the disorders that are most commonly treated in the music therapy. So it was well proven from far back of times. Like many of the other disorders mentioned, some of the most common significant effects are seen in social behaviors, leading to improvements in interaction, conversation, and other such skills. A meta-analysis showed that 30 subjects showed music therapy produces highly significant improvements to social behaviors also. Overt behaviors like wandering and restlessness, reductions in agitated behaviors, and improvement of the cognitive effects. So we can see which are the clear features of and the main symptom burden which we can see in case of Alzheimer's disease, like detachment from their society, detachment from their loved ones. But music can help you to just get things back and to live Even not like that the person used to live in the previous disease-free period, but it can surely reduce the symptom load. The melodic intonation therapy is a commonly used method for treating aphasias and particularly those involving speech deficits. So MIT is a multi-stage treatment that involves committing words and speech rhythm to memory by incorporating them into song. The musical and rhythmic aspects are then separated from the speech and phased out until the patient can speak normally. This method has slight variations between adult patients and child patients. Yeah, the variation comes because of the cognition, because it had some layers of cognition. In case of the child population, the children, they don't understand those aspects of music like an adult person. So there is some discrepancy in the effect of this MIT. Coming to the effect of music therapy, the study was done on the Parkinson's patients. The study population, 32 patients with Parkinson's disease, were all responding to the levodopa. A study intervention was done like 10 minutes listening to relaxing music and visualize the peaceful images, 10 minutes of choral singing, 15 followed by the 15 to 20 minutes of rhythmic movement to music, and 30 minutes of active music improvisation. And the results showed bradykinesia improved. So bradykinesia is one of the dreaded symptoms of Parkinson's disease. And if you can just settle that down, it just clears half of the symptom burden of that patient. So apart from levodopa, we are incorporating music therapy. And researchers have shown that happiness can be measured and it increases happiness and the quality of life is improved in those cases. The musical therapy benefits from motor and the emotional components of the Parkinson's disease. And this study was done on the cancer patients. The study population was the 50 patients were taken, 20 minutes of live familiar music while receiving the chemotherapy was played, and significant reduction in anxiety, fear, fatigue, diastolic blood pressure. So we can see the patients of cancer we come across regularly in our OPDs and the wards. They are going through a dreaded phase of assumption, of fear of getting treated, and the treatment procedure is also so tedious and dreadful. So the effects of chemotherapy, they are so worried about the side effects. So it can reduces the stress of that anxiety, and it can make their lives really beautiful. So overall results confirm that music intervention behave as a powerful independent variable in reducing the anxiety. In case of depression, it is well proven. Music therapy has been found to enable significant outcomes of patients in major depressive disorders. Again, coming to the psychiatric illnesses, which a systematic review of 5 randomized trials were done. People with depression generally accepted music therapy and was found to produce improvements in mood when compared to standard therapy. Another study showed that patients are better able to express their emotional states while listening to sad music than while listening to no music or happy or angry music. So you can see when the patients are listening to sad music, they can correlate their situation with the lyrics and the tones of those music, and it actually augments their expression, and they can speak out their problems, and they can visualize their symptoms, so they can fight those symptoms when listening to music. The authors found that this therapy helped patients overcome verbal barriers to expressing emotions, which can assist therapists in successfully guiding the treatment. So music therapy program for severely depressed persons with Alzheimer's type of dementia, 3 million subjects were taken, and this intervention, music therapy, was given weekly. Each session of 30 minutes, listening, singing, and interactive with an instrument. So it was the passive music therapy and the active music therapy. Both were given combinedly. And the study duration was of 11 weeks. Results showed interaction with other during the group therapy with music was more successful than the without. And coming to the palliative care in depression, when study population, this study was done in 2001. So the study showed that the study population 30 patients with depression and anxiety were taken. Home-based music interventions were given. Because the patients, it's always advised when you are suffering from a terminal illness, you should spend time with your loved ones in your native places. So home-based music therapy is one of the newer invention of modalities related to the music therapy. So you can give music therapy at home, self-implemented music therapy, but committed by telephonic calls or with the therapist. You can call the therapist and how to implement those music therapies. You can just update yourself with regular phone calls with them. So on those data from standardized tests of depression, self-esteem and mood, these all were improved by the music therapy. The benefits seem to last more than 9 months. This was a study it was an RCT which is done on the music therapy in palliative care. The background of the study was that high quality studies were taken for this systematic review. In a randomized controlled trial, 84 hospitalized patients in palliative care unit were assigned to one of those treatment arms, music therapy and the control. The music therapy intervention consisted of 2 sessions of live music based on the relaxation exercises, and the patients in the control group listened to verbal relaxation exercises. It showed that the covariance revealed that music therapy was more effective on the control treatment, promoting the relaxation. This effect was supported by a significantly greater increase in high frequency oscillations of the heart rate. Music therapy did not differ from control treatment with respect to pain relief, but it led to a significantly greater reduction in the fatigue score, and the quality of life of those patients in the study arm increased. It was another study which was the music therapy has experienced a rise in demand as the adjunct therapy, and we searched electronic databases. It was a systematic review for literature containing information on music therapy for palliative care. In keeping with the realist approach, we examined all the relevant literature to develop theories which could explain the music therapy. So this study actually enables you to normalize the music therapy in our day-to-day care and just making it a part of the palliative care given in institutions all over the world. So to cut it short, when you can just remember the effects of music therapy in palliative care patients, it can give you symptom relief or relaxation, reawakening of reworking with an earlier awareness, including pain, tension, dyspnea, nausea, insomnia, restlessness. These all symptoms are seen in all the patients of palliative care setting, and it increases the connectedness. So what is the connectedness? When the caregiver and the treatment provider and the patient, if these 3 wheels of the car is getting connected, then there is always a chance of better outcomes in case of treatment modalities. So it increases the compliance and it increases the effectivity of the general treatment given to those patients. And we can't even ignore the spiritual or the aesthetic experiences given by the music. It gives you pleasure, diversion from the disease. You can divert your mind to the normalcy. You can see the world as you used to see before you had contracted the disease. Creative expressions and support the expression of grief and bereavement. So we should not just ignore that the person is sad. The sadness comes with an expression, and suppressing that expression can lead to some issues in that person's mind. So it's not only that you will just put happy things on the person and just tell them you are not allowed to be sad. You can celebrate sadness also. And dealing with the loss, accepting the patient that he is sad or she is sad can actually make him feel better. Reframing the regret, the helpful catharsis. Music is a great way of catharsis. And we can see in our words that patients are suffering from huge emotional burden and they are carrying loads of emotions from the pre-disease point of view, coming to the disease progression, and they are holding it back inside their mind. So they need someone to talk. They need some way of just ventilating that out. So music therapy gives them that chance. So increasing the confidence and strength for moving forward. So we can see that in all these aspects, music therapy is so needed in today's world. It's not only as a single modality, but in case of all of the modalities which are already there in the literature, we can incorporate this music therapy in all the treatment protocols, and it will actually help the patients to come out of the disease burden, and it will help the caregivers and help the treatment providers like us to understand the patient more and to give not only a drug related care or a conventional therapy, just a complete care which the world is fighting for. Thank you. And with that, we end the presentation.
Thank you, Arkanil. It was a wonderful presentation, and Arkanil has very subtly and very aptly he's described how he's gone, starting from how music started in history, and how it has been studied in science to affect our bodily functions, our physiology, and how studies have been conducted further to explore its effects on quality, not just quality of life, but all other symptoms. And interestingly, while we talk about palliative care, most of the studies are done in oncology setting, at least initially. But very nicely, he's shown evidence that music therapy has been studied in so many other chronic diseases, non-oncological diseases, and have evidence of showing effect and improving symptom burden and quality of life. So it is something that we should all explore in our clinical practice as well. So there is one question from Dr. Pranab. How does music therapy alleviate pain suffering from cancer? So I would, before giving over to Arkunil, I would just say that one thing is that since you asked this question, how do you alleviate pain? It opens so many avenues, because pain in itself is a total pain concept. So pain just does not just consist of physical pain, but also emotional, spiritual, everything. So he has very nicely shown how pain is affecting each and every aspect. And when it comes to the physical pain, like he had mentioned in the physiology part, music therapy is actually activating the reticular activating system. It is and via that pathway, it is affecting our sympathetic, the entire autonomic nervous system. It is reducing, and at the biochemical level, it is reducing your stress hormones like cortisol. It is increasing your endorphins. So that aspect will cover the physical pain. But apart from that, creating diversion, improving symptoms, related to emotional aspects, spiritual aspects, relating to the lyrics, tone, pitch, everything he's covered, and it's a really beautiful therapy. So, Arkunal, would you like to add something to this?
Yeah, ma'am, it's mostly like that. What you mentioned was that the the biophysiological model of the pain, the psychological aspect of pain, the somatic aspect of pain. So it's not only the somatic aspect. We can directly not go into the somatic aspect, but the spiritual and the psychosocial model of pain, which is being addressed here. So that's the thing.
Yes, very nice. Yes, Dr. Pranab has just shared a personal incident, and that he has himself observed in his personal life that suffering from pain had reduced in his wife's case after listening to after listening to music. I'm so sorry. So, any other questions, or anybody would like to add on to the discussion?
Nandini and Shobha, would you like to add something? Because you are a lot of in music. You both are in music. In maybe not in clinical practice, but otherwise. Nandini and Shobha.
Good morning, Sushma. Shobha here. We had published a paper, I think probably in 2010 or 11, if I'm not wrong, because I had a medical student in my mentoring group for undergraduate research methodology studies. So she had done a study, and I think it was published in Indian Journal of Palliative Care. So, and she had made the cancer patients listen to a particular ragam, and she had measured the anxiety and depression after that with HAD scale is what I remember. I haven't read the paper recently, so that was published. So and this was with the students' own interest to, do a study like that. So I had the good fortune to be the mentor for that study, and she did a good job. And she also presented that in, I think, so it must be 2016 at Hyderabad. So that's my experience with music therapy, and I'm sure, like, because it proves whatever's the discussion which Dr. Pranav did this morning is very, very, very well put together. And we all know that the sound has got vibrations, and in a particular frequency, it sort of affects our cells and things like that, which he explained very beautifully. Thank you.
So Sarthak has something to share.
evening.
Sarthak and Pranav. Pranav, first Sarthak, you can open your mic, and then Pranav, please.
Hello, am I audible?
Thank you,
This is
Shobha.
Sarthak here.
Yes, we can hear.
Shall I proceed?
Yes, please proceed.
Hello, thank you so much for bringing music therapy and moving forward this conversation. I really appreciate what the Academy of Palliative Medicine has done. So, in the presentation, I could hear more about what music was and what music did, but it is almost or even more crucial about the practitioner as well. So I'm from Nepal and I've been based in India for about 5 years. I've worked in community settings such as slums or NGOs, childcare centers, to hospitals, and I currently also work at the pediatric palliative ward at Baijarbai Wadia Hospital in Mumbai. So the one thing that one must be aware is that music can be therapeutic, and we also need to know the difference between therapeutic use of music versus music therapy. So therapeutic use of music may be, music using music for oneself, be it relaxation or in yoga, versus music therapy, which has to be practiced by a certified credential. And I think that is where the emphasis is as well. So, just to give a short analogy, uh, if you've got a problem and you speak with your friend and then you get a temporary relief, but the problem might stay with you, then you go to a certified professional who has the skill set and the proper training to address that problem, and then move towards your health related goals. It's the same with music as well. Music can be therapeutic, but music therapy, for one to practice music therapy, one must go through a certified program and to have the correct skill sets and to know all of these techniques and then practice in order to reach a health related goal. I could see a lot of techniques in neurologic music therapy, analytical music therapy, and even guided imagery in music, which requires a degree of specialization, which takes about years for one to practice. It is good that the topic of music therapy was brought out. And at the same time, I would also like to emphasize that there has to be a music therapist, a music experience, a client, and music, the modality working towards a therapeutic goal or a health related objective for it to be called a music therapy. I hope that gives a little clarity about the profession.
Sarthak, I understand what you're saying, but this is just a beginning, just to explain people that music therapy works in day-to-day clinical practice. Okay, and you are right that everything has to be there has to be a protocol, and there has to be a plan that how we will plan to do it. So definitely you are right that there should be a music therapist, and uh, properly, because everything should go in it. But in generally, it's just a beginning, first class on music therapy, I think, and we will take your note definitely. Okay.
Absolutely. And it's so crucial that we address this in the beginning uh, because it is crucial to the profession as well to distinguish between therapeutic music and practices that are indigenous versus music therapy as a profession. And I would also like to share something regarding pain. Pain is quite a big topic. And over the courses that I've worked, so in a nutshell, there can be two ways that we can go about pain. One is active music making method. So their experiences where I've worked in um, cancer settings where the children, especially in the pediatric setting, they're going through a lot of pain through their chemotherapy and probably amputations or other things that they're going through. So in active music making methods, what I generally do in the group sessions is that there are other kids as well. So if they're going through a lot of pain, it can be a means of distraction for them, a creative distractions for them to then distract them from the pain that they're suffering. The other one that I generally use in the hospital is
Short,
a receptor.
can you be short, Sarthak? Because we have other comment. People are trying to comment, and we have only 4
Sure,
minutes.
sure. I'll just quickly finish about the receptive one. So the receptive one would not require the client to be engaged in music therapy, but it uses a technique called grounding, which then is used to anchor and soothe the patient going through the pain and is used in relaxation during several different procedures that happen in the hospital. So I think I just wanted to touch upon pain as well.
Okay, thank you, Sarthak. Thank you for your input. And definitely, it's a beginning. And in India, we have started working on this, and definitely we will take your input. Nandini, you wanted to say something? Nandini, please go ahead.
No, like, nice comments coming on. So I don't know. What I wanted to say is like, it's not like someone who has used music in treatment or in palliative care, but we can remember how, lullabies, which our mother sang, and how it put the child to sleep. And we know about the marching music. We know that different music produces different emotions in us, and each raga has its own emotions. Some are, for devotional, some are arousing, alerting, some are, kind of mellowed, what is it called? Melancholy. So just the raga, even if there are no words, it creates emotions. All of us know that. We simply well up. And that, I think, is the role also, other than all the other, because we are finally made of, rhythms, heart rhythms, and every part of our body we are able to measure. EEG is possible, ECG is possible, all because there is a rhythm. And that rhythm, definitely, if it can be aligned with the rhythm that is available through different ragas and the different presentations, and definitely it requires deep training and a lot of psychological understanding of the person. I don't think all this can be done as prescriptions. It requires a deep understanding of who the person is, and also the practitioner, that relationship. All of that becomes important, but definitely it's an unexplored area, at least in our part of the world. And maybe there are courses happening in some universities, but it's not come into the conventional practice, and I think we should definitely encourage it. And this talk at least has sort of opened out our minds, and little bit of we are a little more open to it. Thank you.
Thank you, Nandini. Thank you very much. So this can be, we don't have time, Pranav. Can you talk to Arkanil directly? Send this question. Arkanil, keep this question. If you can give in 1 minute, you can answer. Are there different ragas and classical music for different terminal diseases?
Yes, ma'am. I have already mentioned in one slide. There is one slide mentioning the diseases and the name of the ragas, which were used in previous Vedic eras also for that. So the name came from
Okay.
those.
Thank you, Arkanil. Final comments from Anuja.
So
Thank
I
you.
would just like to thank everybody who is here and listening, and for an excellent conversation after the presentation and as well. So I just hope that this is, if not, if you can't even start right away with the music therapy in your practice, it is something worth exploring in research as well as in practice. And it is a really new, but actually an ancient method of giving pleasure and reducing pain. So thank you so much, Arkanil. Thank you, ma'am.
Thank you.
Thank you, Anuja and Arkanil, and thank you, Nisha and Archana. Thank you very much. I just want to announce one important thing for PGs, that from after 31st December, we will not be sending you the PPT in the group, because we have realized that PGs are not attending classes in the morning at 6:30. So if at all you want to attend the class, you have to present in the class at 6:30 in the morning. Please inform those who are not available today that from after 31st December, it will not be sent to in your group, and it will be available on the IAPC website, those who are members. So you have to become the member to read their PowerPoint in case you will miss the class. And becoming a member is very, very easy. It's just a 5 seconds. It's 2 minutes job. Go to the IAPC website and just become a life member for just paying 10,000 rupees. So this basically we have done because PGs are not attending morning classes, and people are preparing morning classes with a great difficulty, great effort they are giving. So we don't want to send you ready material on your group So please inform this to all your colleagues that from next after 31st you will not get in your this thing. Thank you very much. Thanks a lot, Arkanil, for good presentation, and Anuja for moderating it so well. Thank you, Nandini and Shobha, for giving your comments, and thank you, Sarah, for your input, constructive input, Sarthak. So, thank you, Nishan, Archana. Very good. We'll see you next Monday before 6:30.